Hi, good afternoon and greetings from Mexico City. It is a great pleasure and an honor for me to share with you a research project about the mental health of pediatric residents in Mexico. We will talk about anxiety, depression, and perfectionism, among other topics. First, I would like to briefly introduce myself. I am currently a research scientist and head of the Clinical Epidemiology Lab at the Clinical Research Directorate of the Ramón de la Fuente Muñiz National Institute of Psychiatry in Mexico. I am happy to share my email addresses in case you have any question, comment, or if you are interested in the publication related to this presentation. And I can't leave this out. This is also me. I am not used to speaking English, so I'd like to apologize in advance for any mistakes in pronunciation or grammar during this presentation. So let's start. It is well known that mental health problems are common in the medical field, and they can become even more evident during medical residency. This may be due to the transition from medical school to residency, which marks a steep increase in mental health challenges. This is not something unique to one country. Both depression and anxiety are more prevalent among medical residents in general, and pediatric residents are no exception. In fact, pediatrics has been described as one of the specialists with the highest emotional burden. In this way, this is a group that warrants focused attention. Pediatric training comes with both emotional and systemic stressors. Residents are students, but at the same time, they represent a vital part of the healthcare workforce. We cannot overlook the role of medical culture around the world, where rigid hierarchies are common, where teaching through humiliation has been normalized, and where tolerance for mistakes is low. Of course, we are talking about dealing with lives, and discipline is necessary. But discipline is not a synonym of inadequate teaching. In an increasingly complex world, mentorship can become scarce. And under stress, relationships during residency may become tense or even conflictive, opening the door to aggression as part of the educational environment. And this becomes even more serious in the case of women going through residency. We are talking about gender bias, caregiving roles, workplace discrimination, among others. But in this case, why do these issues affect pediatric residents in particular? As human beings, we are naturally predisposed to care for and protect children. Because of that, there is a strong drive for perfection in pediatric care. However, this pursuit of perfection can become maladaptive, leading to stress, triggering shame for failing ideal standards, self-criticism, and mental health problems. In recent years, mental health among healthcare professionals has gained more attention. Mental health is especially important in pediatric residents because it directly affects their quality of life. Let's not forget, residents are human beings, and problems with mental health also affect their performance as physicians. The risk of making mistakes that impact the life, health, and well-being of children increases during emotional distress. The perfectionism that is often encouraged in this profession can become harmful, both to the resident and to their medical practice. Considering this background and the lack of information about the mental health of medical residents in Mexico, the objectives of this research were the following. First, we aim to compare certain characteristics related to residency life, such as levels of perfectionism, working hours, and personal mental health history, between pediatric residents with depression and/or anxiety and those without. Then, once these differences were identified, we aim to explore the factors associated with a higher likelihood of experiencing depression and/or anxiety. The present study was part of a cross-sectional study conducted on a sample of medical specialists and specialty residents from Mexico. For the present study, we only include pediatricians in training. We first developed an online survey that was accessible only through a private link provided to the residents. All residents, or the majority of the residents, were invited to participate by the National Autonomous University of Mexico at the end of their annual residency exam. We collected demographic data such as age, gender, and marital status. For residency activities, we include the maximum hours of work in a day, excluding the continuous on-call shifts. Regarding residency-related adversity, we assessed whether residents had experienced any form of aggression, who the aggressor was, and whether they had experienced the death of a patient under care. To evaluate perfectionism, we use the multidimensional perfectionism scale, which includes 5 different dimensions. To assess mental health, we use the ICD-11 screening test for anxiety and depression. Residents were also asked about any previous episodes of anxiety or depression, as well as their current level of distress using a visual analog scale from 0 to 100, where 100 represented the highest perceived level of distress. Using the ICD screening test, we see that 24% of the residents met the criteria for depression and/or anxiety, symptoms that require clinical attention. Among them, 11.8% had only depression, 20% had only anxiety, and 7.5% met the criteria for both depression and anxiety. When we divided the sample into 2 groups, we observed that a higher number of residents with anxiety and/or depression were not in a relationship at the time of the study. They were single. In addition, these residents worked more hours compared to those without symptoms of depression and anxiety. Regarding residency-related adversities, both the presence and the number of aggressive incidents coming from patients, family members, colleagues with a higher hierarchy, or senior residents were higher in the group with depression and/or anxiety. I really want to emphasize this result about aggression from colleagues of higher rank, because The very people who are supposed to provide support during training are in many cases also the ones who engage in aggression, reinforcing an unhealthy and harmful teaching culture. In addition, residents with depression and or anxiety experience the death of a patient under their care more frequently. This type of event can be potentially traumatic and may trigger other mental health issues such as post-traumatic stress disorder. Residents with depression and or anxiety reported greater concern about making mistakes, more indecision when carrying out tasks, and higher expectations regarding their own performance. These results were related to the perfectionism dimensions, and even though the numerical differences may seem small, these traits may reflect maladaptive perfectionism, which should be further explored in future studies. These residents also reported a higher frequency of previous episodes of depression or anxiety, and their level of distress related to residency was significantly higher. When we include all these variables that show differences between groups, along with all the dimensions of perfectionism, we found that the most important factors associated with symptoms of depression and or anxiety in pediatric residents were, first, a history of a previous episode of depression or anxiety, which supports findings previously reported in the literature and highlights the urgent need for early assessment and detection of mental health issues. The second most important risk factor was aggression from colleagues or senior residents, which, as I mentioned earlier, should raise serious concerns about the current educational system in medicine. Interestingly, the only factor that was associated with a reduced risk for depression and or anxiety was organization. Higher levels of organization might help residents to feel more confident when making decisions and performing both in their training and clinical care. When we talk about mental health in residency, we often focus on the individual, on coping skills, resilience, and self-care. But the truth is that many of these struggles are not just personal. They are shaped by the systems we train in that they may also exacerbate pre-existing vulnerabilities. The emotional weight pediatric residents carry often reflects deeper issues in medical culture: pressure to perform, lack of support, constant evaluations. And while burnout has been studied for years, conditions like anxiety and depression are still under-recognized. Depression and anxiety are not just different labels. They have different causes and they require different responses. In medicine, perfectionism is often seen as a strength, but when it turns into fear of failure or shame, it becomes harmful. In pediatrics, where the stakes are high, this pressure is even stronger, and when teaching is done through shaming, it increases fear, not growth. Residents stop asking questions. They hide mistakes, not because they don't care, but because they don't feel safe. And often, this fear comes from those in higher positions, attending supervisors, colleagues, other residents. And aggressions from above sends a message. You must be perfect or stay silent. Mhm. But silence in medicine is dangerous for both patients and providers. We need to build a culture where learning includes vulnerability and where emotional safety is seen as essential, not optional. The emotional impact of adverse events, such as a patient death, is often unacknowledged or poorly managed with current training frameworks. Death in medicine can be seen as a normal event, but sometimes the death of a patient may have a profound impact on on the resident or all the healthcare team. We need to rethink how is medical culture. It's important to shift from a punitive, perfectionist model to a supportive and reflective environments. We need to recognize mental health care as part of professional competency, not a personal failing. Normalizing mental health care may reduce the long-term toll of pediatric residents and physicians in general. And in this last slide, this is the message I want you to take home. Caring for our residents is caring for the future of health care. And finally, this is our wonderful Mexican research team. Thank you for your attention, and please, let's take care of ourselves and let's take care of our residents. Thank you.